This is Inspiring Careers with your host, Ingrid Centurion. We're going to talk about fascinating technologies that will impact your future. Meet inspiring entrepreneurs and people that are making huge differences in the community and around the world. We're going to share career and life lessons of inspiration and success. Our mission is to inspire our viewers to make a better life for themselves by sharing our stories, our interviews, and documentaries. Please stay tuned as we have incredible guests coming up. I have life-changing stories for you today with Dr. Josh Dunsky. He's been practicing for over 20 years. So tell us about your background, where you grew up.
I grew up in Needham, Massachusetts, and in high school I would accompany my mother to her chiropractor. My mother suffered from pretty bad headaches, and our chiropractor at the time was helping her tremendously, and that was, to me, that was wow. My father's a practitioner, he's an endodontist.
Hold on a second, what is an endodontist?
Root canals.
Root canals,
yeah,
okay.
Oral surgery, root canals.
Okay.
And so there was a time where I thought I might do something in that field or something in medicine, until I went with my mother to her chiropractor and really got turned on to the fact that without drugs, without surgery, there was something that she was able to do to help her headaches. And then it just snowballed from there. I had a shoulder injury, I went to a chiropractor, and that chiropractor helped my injury, and I was able to avoid surgery at the time, which I was told that I needed.
So were you really athletic in high school?
Yeah. Played sports all my life, hockey, soccer, lacrosse, pretty much from 3rd grade on up.
Wow. I want to inspire people to go after their passion. So you were an athlete, you know how to work on a team, you saw your mom in pain. When you decided to go to college, how was that transition, and when did you make that decision? I mean, tell me about that.
It was kind of in the background all the time. I didn't know what really I wanted to do. I thought business, healthcare, and it was probably halfway through college that I realized that I really wanted to go into some field in medicine. And because of what I experienced with chiropractic care with my mother, I got turned on to it and found out I had a cousin down south who was a chiropractor, and his 2 kids, one of his sons at the time was in chiropractic school. Started talking with him, and boom, just went full tilt, did my pre-med, got through that, and then graduated college, and then went down to Atlanta for my doctorate.
Now let's get into herniated disc, slip disc, and ruptured disc. Tell us about that, and what does that mean?
Yeah.
Because I have a bad back, and a lot of people have bad backs, or a lot of people have a bad back and they don't go to the doc, and they just have a lot of pain. Then it gets better maybe 4 weeks later, and then it's a reoccurring thing.
Right.
When do you get to that point where you know, I need to see the doctor and I don't want to take medication?
Sure. Great question. So for me, it's very important that someone gets treated as soon as possible. And how do we know that we have those types of problems? X-rays and MRIs are the best way to tell if it's truly due to a disc, due to a nerve. Back to your first question about slip disc, ruptured disc, those are kind of layman's terms which a lot of people use. There's a bulging disc, there's a herniated disc, there's several things that can happen with a disc injury. And basically the concept is, if you think of a jelly donut and you squeeze a jelly donut, that jelly starts to migrate out of the donut. That's what happens to our discs themselves from trauma, from small traumas every day, poor posture, work trauma, and then there's car accidents, falls, getting hit playing football, soccer. So many things can cause damage to the disc, but it starts to migrate, that jelly starts to migrate out and causes a bulge. And that bulge starts to impede on the nerves around it, and eventually that bulge can rupture, and that's what a herniation is. And there's several degrees of that herniation.
Do you see like MRIs and X-rays and you're like, oh my goodness,
oh, I can show you
it's
some.
very bad.
Oh yeah.
Right.
Oh,
so
horrible.
that's where they're at.
I can show you X-rays right now. I can show you severe damage in a 30-year-old. A 30-year-old spine looks like a hand grenade went off in that spine, versus a 60-year-old who has a pretty clean-looking spinal column. And I can show you, incontinence. I can show you digestive problems where there's damage in the disc and what level nerve that it's hitting.
And I know sometimes these kids in high school,
they
Oh,
already
yeah.
have back problems.
Not only
They're
back, oh yeah.
they're working out incorrectly, poor posture, and things like that. And so that jelly donut, that's like splashing out.
Yeah.
We need to educate them so that doesn't happen, because your
Oh, yeah.
body is so important in the future.
Absolutely. I have young gymnasts. I'm talking 5th grade, 6th grade. We have many middle schoolers that do cheer, gymnastics, they're in crew, and they have ruptured discs at such a young age, and they're getting treated here. I mean, several. We have several Olympic athletes that have gone through the program,
So
professional athletes.
what caused that?
Trauma. So there's poor mechanics. So if you're exercising in a way that's not good for you, if you're listening, there are so many professionals out there, and most of them do a great job. There's some sports, there's some activities which are not good for the disc. And quite simply, it's like sandpaper on that disc all day long. It's just a matter of time until those fibers rupture, and boom, you got a herniation or a severe bulge pinching the nerve. And no one wants to be in pain. I don't want anybody to be in pain, but honestly, I'd rather someone be in pain than start to have neuropathic symptoms like numbness, tingling, burning, severe squeezing around the feet. That's where you're getting into long-term nerve damage. So when someone's in pain, great, but let's get them evaluated, x-rays, MRIs if we need to, and then treat them accordingly. Not everybody is a candidate for what we do, so we have a very specific program for nerve injuries and disc injuries. That's all I do.
So what would you tell a parent who they want to get their child involved in gymnastics and they don't know these things, and there they are, they're so young, 6, 8 years old, they're putting all this pressure, they're performing these exercises. What would be the advice, symptoms that they need to be looking for, because we need to take care of their bodies?
Sure, absolutely.
And I wish I'd sprained my ankle so many times playing soccer, and my ankles now just roll. I have 4 herniated discs. My mom didn't know.
Right.
What would be some advice for them?
Absolutely. From day one, get a good chiropractor. Get adjusted regularly. That a chiropractic adjustment, getting under care, keeps your spine working properly, keeps the mechanics working properly, keeps the pressure off the nerves. So you don't need to come see me. Although I am a chiropractor, our niche is really in the disc and nerves. But you don't want to come to my office. You want to do something that'll prevent you from having these problems, so you don't have to see me. And that would be exercising the right way, mechanically sound, having a good instructor in whatever your sports are, good coach, getting adjusted on a regular basis, stretching, those types of things, eating properly, nutrition, all of those things. It's like your bumper. It's like your force field that's going to protect your body from breaking down. Unfortunately, because of some of the sports that we do and some of the activities we're involved with, even doing those things cause trauma to the joint, and the pain usually goes away over a period of time. But now if you have gears that aren't lined up properly and you keep using them, no pain for months for years, and all of a sudden, now my back is sore. And we take an x-ray and there's arthritic changes in that joint that happened 3 years ago. So it's getting checked, it's doing the best you can do, but if there are signs and symptoms of prolonged back pain, especially in a young child or an adolescent, if you have radicular symptoms, pain down a leg, numbness or tingling, absolutely get into a facility like ours or someplace near you to evaluate that problem.
I know you've seen a lot of patients. Can you share with us some client that it's just an amazing story, or you couldn't believe that this happened?
I don't have one of those. We have thousands of those. I've been doing this for 20 years. Honestly, and you got to visit yesterday. You walked by a couple people that have been here for a long time, and they're in for maintenance. They're doing great. They come once every 2 months to maintain what we've done. We have so many of those stories. One woman that comes to mind, we released her from her initial intensive care program after 4 months. And if you saw her when she walked in the door, and I wish we talked about her yesterday, my staff would tell you, severe chronic fatigue, severe fibro, right? We have a lot of patients that come in with fibromyalgia diagnosis, really overprescribed, if you will. There are people who truly do have those problems, but I think sometimes when we can't figure out what's going on, they're often labeled as fibromyalgia, my body hurts all the time.
Okay.
She came in, her quality of life was very poor. She's in her late 40s. You would not believe her today if you saw her, and you can see her because she's given us one of her testimonials. She was almost incapacitated, horrible pain every day, severely depressed. She couldn't work, and she came in here on a referral from someone. She ran a very busy company. She couldn't do anything. Her quality of life was very poor. You wouldn't recognize her today. Honest to goodness, you would not recognize her. She's on our website. You can see her story, and that's what we do with everybody. We want to look at the underlying cause of the neuropathy, of the disc injury, the pain, whatever that may be, and treat it from a multitude of areas. Because nerve injuries, it's not just due to one thing. A disc injury is not just due to one thing. There's several components that have to be addressed, and we do that all here, non-invasively, non-surgically, to get someone back to living their life. We have 80-year-old skiing moguls right now. We have 80-year-olds in playing golf in Boca Raton, Florida right now after 13 years of debilitating pain. So it's not curing anything. It's allowing the body to cure itself and heal, or live up to its potential, whatever that may be.
And so let's talk about that exactly. What makes you unique? I mean, you are a chiropractor.
Yes.
But your specialty and what you focus on here is spinal, nerve, spinal degeneration,
Peripheral
neuropathy,
Yep, and pain management.
and pain management.
Yep.
So
From a
would someone-
non-surgical, non-invasive.
So would someone go to another chiropractor and then they see him, then they get referred to you?
Often, very often.
Okay,
My
that's the normal progression.
normal progression,
But
or
what if I wanted you to be my chiropractor?
Sure,
Will you
we-
still take patients?
of course.
Okay.
Of course, but what we mainly do and what we focus on are disc injuries, nerve injuries, and pain management. So we have a lot of patients. I have many friends in medicine. They send me their neuropathy patients. They'll tell you what they do typically does not work for neuropathy. There's a time and a place for everything. Medicine is fundamental. We need it. If I'm in crisis care, put me in their care, keep me alive. But certain things, and they'll be straightforward, most of them, management with medication can help someone be more comfortable, but it's not going to reverse neuropathic symptoms. What we do in here is all documented. It's in all the literature, Journal of Neurological Research, orthopedic journals. Nerves do grow back, so there's different types of nerves. The central nervous system, the brain and spinal cord, not that we know of right now. There's not much you can do when that's damaged. But the peripheral nerves, the nerves that come out of the spinal cord, that go down your arm, they go down your legs, they go to your skin, they go to your motor function, they go to your organs, they do grow back as long as they're in the right environment. So what we do in here, non-invasively, non-surgically, is facilitate that environment. You've got to lower inflammation. You've got to turn the nerve back on. You've got to do several things to help alleviate the pressure off the nerves. And just like if you cut your finger right now, you don't put any medicine, any bacitracin and Neosporin on that cut. If you're relatively healthy, it's going to heal. But if you take sandpaper every day and you rub it in that wound, it's never going to heal. That's what neuropathy is. That's what disc injuries are. There's constant friction, irritation every day. That's why it's called a chronic injury that gets worse and worse and worse.
Tell us about your equipment that you have here. You have some high-tech equipment. Take me to the office. We'll walk around the office later.
So one of the first things that we do with a disc injury is we use what's called non-surgical spinal decompression therapy. Spinal decompression helps to reestablish the pump. There's a pump in our spine at every segment. So we have a disc, and that disc needs to pump to stay alive. You and I need to eat and drink every day. If we don't do that, we'll die. The disc needs to eat and drink every day too. And from trauma, whether it's little micro traumas, little things that we do every day, or blunt trauma, that disc slows down its pumping function and can stop. And so if that pump stops, it dries out, cracks, tears, and then ruptures. Spinal decompression therapy either can start a disc up pumping, okay, or help the body start up that pumping through mechanics, or can facilitate a disc that's starting to slow down that pumping process. So it's run by a computer. We use pneumatics, air pressure, and what we're doing is we're creating negative pressure. We create a suction to pull fluid back into the disc. That's spinal decompression therapy. Does many other things too. Great for spinal arthritis and things of that nature. We also have laser technology that we use. Lasers are phenomenal to increase oxygenation in the body. What the lasers do is they typically dilate capillaries. They increase blood flow, help decrease inflammation, they decrease pain, and many lasers right now cause what's called angiogenesis, the proliferation of new blood vessels. So imagine having an injury to an area and you have all this scar tissue. The only way the body can heal and get rid of scar tissue is through movement, mobilization, and an influx of oxygen. That's why lasers are so powerful in healing the outside layers of the discs. We also use electromedicine. So we use several machines that are here. They're called Hakka Med. Hakka Med is a type of electromedicine that achieves such high frequencies, we can stimulate the nerve and cause neuroplasticity. That's the regrowth of nerve tissue.
So is the Hakka Med like the TENS unit?
Very different. So
okay.
TENS, yeah, good question.
Because
So
the electrodes, they were putting them on the patients yesterday, and I saw that, and she
Right.
told me Hakka Med. How could you ever forget that name?
Sure.
Hakka Med.
Sure. Yeah, there's a difference. TENS units today you can buy for $30. This
Right.
machine that we use are $30,000 a piece. Actually, the gentleman who invented Hakka Med, he invented interferential stimulation, which almost every chiropractor and physical therapist uses in their clinic, and they're great tools. Great for certain things. They offer more short-term relief. So those devices, TENS units, electrical muscle stim, they tend to go up to about 150, maybe 200 hertz. Hakka Med goes up to 20,000 hertz. And the reason that is important, yeah, it's pretty impressive, is because between 4 and 12,000, it's called horizontal frequency modulation. And by the way, the Hakka Med has the patent on this technology. No other machine does horizontal frequency modulation. What that means is we're able to achieve a chemical and electrical change, a biochemical and bioelectrical change in the nerve at the same time. That's why the nerves grow back. We hit those frequencies where the nerves fire at. If you don't do bicep curls, you're going to have atrophy. You're going to lose the bicep muscle.
Right.
If you don't do cardiovascular exercise, your heart's a muscle. It's going to atrophy. If the nerve impulses are not working on that nerve, the nerve atrophies. And the number one reason for that is hypoxia, lack of oxygen. The Hakka Med turns that switch back on. And it doesn't take a long time for that to happen. We can also use the Hakka Med for pain management at certain frequencies, like 4,000 hertz. That technology cleans up chemicals. One of them called CAMP, cyclic adenosine monophosphate, causes pain. The Hakka Med cleans that chemical up, and that's why we can alleviate pain usually very quickly with patients. Some take a little longer, but it's pretty immediate.
So the police officers, when they shoot that gun at you and you're like,
oh my goodness, those higher frequencies, you get into some discomfort. We don't go up there. We stay between 4 and 12,000 hertz generally. There are times where we'll migrate beyond that, but the patient's always comfortable. In fact, you saw patients yesterday.
right.
They're in a very comfy chair. They recline. They listen to their
They were chilling.
iTunes.
They were like, woo.
Yeah.
And they also had some glasses on.
So
what was that?
Exactly. So those goggles are used when we use the laser. It's important for eye
Oh.
protection, to cover up the eyes, to protect them from laser, and
And she was chilling. She looked happy.
People, this
She
is their
had-
peace meal during the day.
Right.
People come in here and they chill out for 45 minutes.
That reminds me. So he was telling me, this is like a massage.
Yeah.
This was his massage, relax time. He had a major neck pain.
Yeah.
And he's feeling so much better.
It's amazing. I'll tell you, patients finish up the therapy. They're feeling great. They're at the end of their 2 or 3 month course, and they want to come in every day because they love how they feel when they're here. They're relaxed. It's the technology we use. It doesn't have to be uncomfortable. In fact, many people on the decompression table having Hakka Med, they fall asleep. It's very relaxing, and all we're doing is we're working with the body's mechanics, but we're getting the job done. You have to mechanically change the damage that's being caused to nerves and discs to treat them. So, and unfortunately, this whole world is medicated, trying to cover up the symptoms instead of getting to the problem.
I was a maintenance test pilot in the Army, and my job was to find what is the root cause problem of this incident before the aircraft goes up again. And you're exactly right. All we do is patch over, put a Band-Aid, and never get to the root cause of problems. I have a question on the Hakka Med machine. Could that be once you're seeing a patient, how often do they need to be on the machine? Because if it is like a massage, some people get massages once a week, some people get a massage once a month, and he was saying this is his massage for him. Is there a recommended frequency of going on the Hakka Med machine?
Sure, yeah, absolutely. Everybody's different. So when I first see a patient, they need to qualify to become a patient here. What that means is I only treat specific problems. Not everybody's a candidate. I sent out 2 gentlemen last week that were not candidates for our program, and unfortunately I hate telling people that, but I want to really get them in the best place to suit their needs. That's not always us. If they're a candidate, everybody's different. So if you have 3 levels of disc ruptures or herniations, you may be treated with a slightly different protocol than someone with 1 disc bulge or spinal degeneration or spinal stenosis. Spinal stenosis with neuropathy, without neuropathy, everybody's different, but typically a typical program would be 3 times a week for the first 2 months, and then we wean you down, and that goes for decompression and laser also. Typically a program is 2 to 3, sometimes 4 months for the initial intensive care, and then maintenance once every 2 months to come in for a tune-up. So although he loves coming in for the treatment, I'm going to have to sadly tell him, okay, now I want to see you in 2 weeks or 3 weeks to see how this is doing. So it's not an indefinite program. I love massages. I would go every day for a massage if I could. Unfortunately, this is real high level technology, and you don't need to, because generally speaking, it gets the job done in a set period of time.
So you're really busy. I mean, patients. How busy are you? Can you take on another 50 patients, or will this facility be a little bit too small for you?
Oh no, but we just purchased another Hakka Med machine because we don't want to make people wait. When someone's in that much pain, excuse me, when someone's in that much pain, we want to get them in and get them treated immediately. So no, we are, and remember, as people are finishing up their treatment, we're starting new people on. So we are limited. You know, we will take 2 new patients, 2 or 3 new patients a week into our program. We do more consults than that, but we can start 2 or 3 new patients up a week, basically with 1 unit. We have several units to help establish that, so we're not making people wait.
Excellent. So the uniqueness is they come here and you've got to evaluate them and make an assessment if they meet
Certain
criteria, and then they come on board 4 months, 6 months, and then they go into a maintenance phase.
Right, and if they're coming in I have a lot of referrals from other chiropractors. They're coming on board for a specific thing here. I send them back to their chiropractors after we're done. We don't keep them as a patient. That's not my job. My job is to specifically treat the nerve, the discs, or the pain management if what they're having done right now isn't working. Typically, you know, the prescription load on one patient, you would not be, or I should say, you'd be very surprised to see how many medications people are taking to manage the pain or to dull the symptoms from neuropathy or disc injuries. And I'm not anti-medication. I'll tell you right now, I'm anti-inappropriate medication. If you need insulin to stay alive, you're on that insulin. If you have seizures or epilepsy, you need that anti-seizure drug, you stay on that. I'm talking about drugs that are not enhancing the quality of our life. I'm talking about drugs that are very toxic, that aren't helping. You might want to think about that, and that's a discussion for you to have with your doctor. But if you're on medications that can be excluded from your lifestyle and not be taxing your body through what we do, that's what we try to get to.
There's so many people that take medications, and I watch these commercials on TV that are like the side effects,
Death.
heart palpitations, kidney problems. You read all this stuff. Don't they think about that stuff?
They do. They have no one else.
No, they have you. They can
have
come
me.
to you.
Right.
And this could be
There's no place
from,
that they knew of to go.
That's right. And could be from a headache to an eye problem to all these. It's interesting to see how, with your mom, she was having headaches, and that was the back and the spine.
If I told you how many people...
Something that I find fascinating, that you don't even realize that the root cause is a spinal problem.
If I told you the number of patients that we see with headaches, they come in, they've done everything. They've gone to acupuncturists, physical therapists, chiropractors, medical doctors, medications, done everything, and they're still having problems. They come in here, we shoot a simple x-ray. I do digital x-ray in the next room. We find damage in the neck. There's several types of headaches that are caused by the spine. There's other headaches that are caused by hormones, migraines. There's a lot of headaches. We don't know what's causing them. But I will tell you, there's an overwhelming number of people that are suffering with headaches. There's damage in the neck. We can see exactly where it is. In a short period of time, they feel what we do is working. Same thing for the low back. A lot of people come in with low back pain. It's coming from the neck. Some people come in with neck pain. There's nothing wrong with their neck. It's their low back. So you can have referred pain. You can have referred problems, but you have to have a good evaluation.
So tell me, why is it sometimes like I sleep wrong and I wake up in the morning and I'm like, what's up with that?
Yeah, usually there's a problem already there.
Oh, really?
So I had a woman across the street at Whole Foods across the street, or maybe I should say a grocery store across the street. She's throwing her groceries into her trunk. She's in her early 40s, not one day of back pain. She's never had back pain or neck pain before. All of a sudden she can barely move. Ridiculous symptoms right down her leg, excruciating pain. She comes in the next day, took x-rays of her neck and of her low back. Horrible destruction in there. Horrible. If you've never seen an x-ray and I show you her x-ray, you would cringe. Pain is one symptom. The absence of pain doesn't mean we're healthy. You can have cancer for 10 years inside you and not have any symptoms. So we are in such a symptom-based society. Well, if I don't have symptoms, I must be healthy. Wrong, wrong, wrong. That's what preventive medicine wants to alleviate, the problem from that. So having a good evaluation is very important. We took a couple pictures of her. We know what the cause is, and yet she's so mystified at the fact that she never had pain before. Doesn't have to have pain until one day you go to pick up your child, your grandchild, you throw groceries in the trunk and can't move. You sleep wrong. Hey doc, I slept wrong last night. It's probably nothing, I'm just gonna have a massage. Well, for sometimes that can work.
I have another incident. Well, I was a helicopter pilot and I used to wear this heavy helmet on my head. And if I would turn my head too fast sometimes to look for an aircraft, and I don't even want to do it right now, I would get like a sharp burning pain, and then my neck would be stiff. That has also happened a few times where I turn real quick and that same pain will come back.
Sure.
So what's going on there?
It could be arthritis, could be damage in the disc, could be damage in the nerve and the tissue around it. But it's very simple to see. It's very simple to diagnose.
Okay.
And I'll tell you something, Ingrid, it is so treatable and preventable from getting worse. So forensically, I look at MRIs and x-rays for practitioners all day long. I coach. I do a lot of implementation with these programs with medical doctors, chiropractors, physical therapists. I look at these for other practitioners, and you can map out what a spine looked like 2 years ago, 5 years ago, 10 years ago, 20 years ago. You can stop the progression of these problems the sooner you get treated. And unfortunately, I see people, I started someone up last week that I saw 6 years ago, 7 years ago, that I said, you're a candidate. If you want my help, I'm here. If not, that's okay, but it's not going to get better. It's going to get worse. No, I'm going to do this, I'm going to do that. 6, 7 years later, came back in much worse. Can we still help? Sure, but the prognosis is a little different now. So, we got to listen to those red flags. So if your oil light comes on in your engine on your dashboard, you're not going to put duct tape over that oil light. You better put oil in your engine. You know what's going to happen. We're just used to taking pills and the pain's gone. Yeah, but you know what's happening every day? Aberrant grinding motion on your discs and on your joints, and eventually you're going to sneeze, you're going to turn your head, you're going to sleep wrong, and then you're going to lose the use of your arm or atrophy or numbness and tingling. Any of those things can happen.
That is so true. I want you now to take me and let's go out in the office. Show us some x-rays. That would be fun. Show us some x-rays. And for those of you watching, if you're in some type of pain, Dr. Dunsky is here for you. And you are so right. We all need a maintenance plan for our bodies. I don't think people really think about that.
Right.
We have the maintenance plan for the car, like you said.
Perfect.
And they give you that manual, and we need a Dr. Dunsky maintenance plan.
We've
like that.
Well, I like that too. Can I use that slogan?
Because
That's so
the
true.
maintenance plan.
It is.
Even when I was flying my helicopters, we had a preventive maintenance plan.
That's it.
Because
That's
when
right.
you're flying an aircraft, you can't afford anything to go out.
That's right.
So we were always checking and doing all these overhauls and maintenance
The
procedures.
attention to detail that you put into those aircrafts, it's the same attention we should be putting to ourselves. We have one vessel, we have one body. Why wait till the cancer comes in? Why wait till we're diabetic? Well, what if we can get you when you're pre-diabetic? What if we can solve a disc problem before it actually starts to become a real issue?